Student nurse questions the nurse about why the patient has 20 MEq of potassium chloride, KCl, in his 4. The nurse explains the purpose and then refers the student to which laboratory test. A. Electrolytes. B. Glucose. C. Hemoglobin. D. Arterial blood gases. Answer. Rationale. A. Measures potassium, among other things. B. Glucose. C. Hemoglobin. D. Arterial blood gases. 2. A patient undergoing outpatient anticoagulant therapy asks why he has to have blood drawn every week. The most appropriate answer the nurse should give is A. 1. The doctor needs to know if the infection is improved. 2. A patient undergoing outpatient anticoagulant therapy asks why he has to have blood drawn every week. The most appropriate answer the nurse should give is A. 1. The doctor needs to know if the infection is improving. B. 2. The doctor adjusts your dosage to help you maintain a therapeutic level. C. 3. The doctor needs to know if the medication is working. D. 4. We don't want the medicine to become toxic. Answer. Rationale. 2. The physician adjusts the dosage according to the results of the partial thromboblast in time. 1. This medication is not used for infection. 3. This is true but does not fully answer the question. 4. This is true but rare. It induces undue anxiety. 3. A patient asks the nurse why he is receiving patches of nitroglycerin instead of just taking it under the tongue when he needs it. The nurse explains that, 1. Given in this manner, the medication is absorbed at a slow, steady rate. 2. This manner is effective in acute situations. 3. This manner allows for more accurate dosage. 4. Patches administer a day's to a week's worth of medication. Answer. Rationale. 1. After application to the skin, the medication is absorbed at a slow, constant rate, allowing for the maintenance of a therapeutic level. 2. Absorption through the skin is slow and therefore is ineffective in acute situations. 3. Sublingual and transdermal methods both allow for accurate dosage. 4. Although true, the patient's question is not answered. In addition, dosage and the length of time for administration depend on severity of the condition and require a physician's order. 4. A patient is receiving D5 RL at 150 milliliters per hour. The drip factor for the tubing is 20. The number of drops per minute is answer _ drops per minute. Answer. Rationale. 5. A patient with cancer has been receiving high doses of morphine for several days. During an assessment, the side effect that the nurse would be likely to see is 1. Constipation. 2. Respiratory depression. 3. Pain relief. 4. Diarrhea. Answer. Rationale. 1. Patients need to be on a bowel program. Constipation is the only side effect for which patients do not develop a tolerance. 2. A patient develops a tolerance to respiratory effects when dosage is gradually increased. 3. Pain relief is a desired effect. 4. Constipation, not diarrhea, is the usual side effect. See rationale for number 1. 6. The physician has ordered mycostatin 5 milliliters, swish and swallow twice daily. The nurse should instruct the patient to 1. Swallow the medication quickly, and follow with 8 ounces of water. 2. Shake the bottle before administering to help mix the suspension. 3. Brush your teeth carefully before each dose. 4. Maintain contact with the mucosa as long as possible before swallowing. Answer. Rationale. 1. This is an improper procedure. It minimizes contact with the affected area and then rinses away medication. 2. There is no indication that the medicine is a suspension. 3. This is fine. However, it does not answer the question of what swish and swallow means. 4. This procedure allows for maximal contact with impaired oral mucosa. 7. The nurse will know that the patient understands teaching about self-administration of oral corticosteroids when the patient states that she will take the medication. 1. Before meals. 2. With or after meals. 3. At bedtime. 4. With orange juice. Answer. Rationale. 1. This medication can irritate the stomach and must be taken with meals. 2. The medication is considered ulcerogenic. 3. This medication can irritate the stomach when not taken with meals. 4. This medication is taken with an antacid, not orange juice, to prevent stomach irritation. 8. Which intramuscular site in a child does this picture represent? 1. Rectus femoris. 2. Vastus lateralis. 3. Ventrogluteal. 4. Deltoid. Answer. Rationale. 1. The rectus femoris muscle lies medial to the vastus lateralis muscle but does not cross the midline of the anterior thigh. 2. The vastus lateralis muscle is located on the anterior lateral thigh away from blood vessels and nerves. 3. The ventrogluteal muscle is a large muscle mass free of major nerves and adipose tissue. 4. The deltoid muscle is located in the arm. 9. After assessment of laboratory work, the physician orders 2 units of packed red blood cells, RBCs, for a patient. The nurse knows that the tests the physician used to assess the need for RBCs were 1. Blood glucose 2. Electrolytes 3. Hemoglobin and hematocrit 4. Specific gravity answer rationale 1. A fasting blood sugar measures the amount of glucose in the bloodstream during a period of fasting. Coagulation studies, PT and PPT, are used to monitor anticoagulant therapy. 2. Electrolytes measure the amount of elements essential to bodily function. Potassium, sodium, calcium. An elevated WBC indicates the presence of inflammation or infection. 3. These tests measure the levels of hemoglobin, the oxygen-carrying component of the RBC, in the blood and the hematocrit, the number of packed RBCs found in 100 milliliters of blood, and provide an index to the severity of possible anemia. 4. A change from the normal specific gravity indicates dehydration or inadequate kidney function. A routine urinalysis provides information about renal function and systemic health. 10. A nurse is making a home visit to care for a patient with chronic obstructive pulmonary disease. When she arrives at the home, she finds that the couple has a big box of medications all mixed together, and some of them are outdated. The first priority should be to 1. Examine all the labels to determine which ones are still viable. 2. Question the couple to see what medications they are taking. 3. Report the situation to her supervisor so that she can contact the physician. 4. Contact the social worker to begin placement proceedings for the couple. Answer rationale 1, 2. These are subsequent steps but not first priorities. 3. The physician needs to know to verify any needed prescriptions. 4. This is very premature. The couple may need education and support.